Good evening, everyone. I'm Dr. Malika Marshall, coming to you from my home to yours. Thank you for joining us tonight to honor VNA Care nurses and clinicians and the wonderful community that supports VNA Care. And I want to congratulate the many wonderful sponsors who stepped up to participate and make a meaningful impact. Thank you. A gala is typically a time to celebrate, and there's no better time to recognize and celebrate the extraordinary real-life heroes among us, VNA Care's nurses and clinicians. Tonight, you're going to see tales of courage, tears, and joy. You'll hear stories of compassion directly from the frontline nurses, their triumphs, daily wins, and losses, stories that will inspire hope and strength, and that will make us think of more ways we can help support the work of VNA Care. Speaking of which, do you see the text to donate box below? Let's make good use of texting. You know, I've been involved in this organization and have emceed its annual gala for a number of years now. And while we can't gather in person this time around, I'm so glad we're taking the time to show deep respect and appreciation for the heroes in healthcare who've helped our communities, our families, our friends get through these harrowing times with compassion and grace and empathy. We salute all of you who have sacrificed your time and put your own health at risk to take care of us. You're truly doing God's work. Before I introduce our first clinician, I want to give you some idea what their roles entail. For visiting nurses and other clinicians, such as rehabilitation therapists, their chosen profession to care for patients and families in the home environment is unique, rigorous, and highly personal. Unlike a hospital where a healthcare worker knows their surroundings, these clinicians interact with patients in an unfamiliar environment. Walking into someone's home, apartment, nursing home room, or other housing arrangement. They see the many different ways we live and our unique family relationships. They also encounter many unexpected circumstances that they resourcefully navigate. And today, the challenges they face in providing this care have dramatically increased. When the world shut down this spring, VNA Care heroes stepped up. In the height of the crisis, VNA Care helped keep coronavirus patients out of hospital beds to free up space for those who needed ICU-level crisis care. Day in and day out, VNA Care's frontline healthcare nurses and clinicians have worked nonstop since March to care for patients and families in the community. Through the depths of the COVID-19 crisis, these clinicians went into patients' homes to provide hands-on vital healthcare services. They did so under enormous stress and with great courage and commitment. Even in normal times, home health and hospice clinicians bring so much more than expert health care into patients' homes. They bring comfort, hope, and support during a very difficult time. They help people live with dignity under some incredibly challenging circumstances. To these nurses and clinicians and the rest of the healthcare heroes, you know what you bring each day: dedication, compassion, and resilience. And now we get to recognize you and thank you. The mayor of Boston, Marty Walsh, is here with us to salute VNA Care's heroes in healthcare. When he heard the words Visiting Nurse Association of Boston, I'm told he jumped at the opportunity to share the city's appreciation for playing a central role in the fight against COVID-19, and on behalf of the 6,500 Boston residents who rely on their services. Welcome, Mayor Walsh.
Hi, this is Mayor Marty Walsh, and I want to thank the Visiting Nurse Associations in Boston for your dedication in serving COVID-19 and at-risk patients. That includes every frontline nurse, clinician, and staff member. The coronavirus pandemic continues to be one of the biggest challenges we've ever faced. But I've never been more proud, as mayor, to see how Boston has risen to meet this challenge time and time again. Everyone has a role to play in this crisis. Nurses and healthcare workers have been critical partners from the very beginning in keeping people safe and healthy. Your work has never been easy, but it's especially critical now. Patients and their families rely on you for their medical care, and they rely on you for a sense of comfort and hope as we all move through this uncertain period together. We must all remember that we will get through this crisis, and our city will be stronger for it. Boston will always be grateful, and we will always support you. We applaud your commitment to keeping our residents safe and healthy. Thank you.
Thank you, Mayor Walsh. We appreciate your being here with us. A recent patient and longstanding supporter of V&A Care's Durham Hospice Home in Cambridge wanted to share a few words tonight. For many, he needs no introduction. Marvin Gilmore is a humanitarian, civil rights activist, honored World War II veteran, and entrepreneur. He has worked tirelessly to bring economic empowerment, development, and opportunity into Boston's underserved populations. He co-founded the first African-American owned and operated commercial bank in Boston, which is now One United Bank. In 2010, he received France's highest honor of merit when he was named a Chevalier of the Legion of Honor due to his heroic service in World War II. I will let Mr. Marvin Gilmore take it from here.
And I got to applaud the V&A for the service they have done for the community. That's what life is all about. When I had an accident on my leg, the V&A stepped in to take good care of me, and I never will forget that. So now I'm walking, I'm very healthy, and I love the V&A for taking the personal care that they've done in terms of my life. Maybe that's why I'm now 96. I don't know. Because of the V&A, who are taking good care of me through my life. My life has been to help others. All my life, I've been doing just that. No, all my work has been jobs, helping others could help themselves so they can have a meal, they can have food. It's not me, it's what I do for them. We're all together, both black, white, yellow, whatever you want to say. We're all together to make a change in life. Mankind start doing the right thing to each other. And also keep a smile on your face. That's so important. And I hope that the V&A will help us to do just that and the work that they have done too as well. There's an organization out there that's willing to help both financially, spiritually, there to help you when you cannot wash your face and your body, who cannot dress yourself. V&A knows how to do that. We have nobody there to call upon. The V&A is there to do just that for you. So this is part of why I love the V&A nurses for the work they have done and how they've done it in a most beautiful way.
Ooh, Marvin, you're a tough act to follow. Thank you. Now I want to kick things off by introducing V&A Care's President and CEO, Todd Rose.
Good evening, everyone, and thank you for joining us for our first ever virtual Heroes in Healthcare Gala. It is great to be here, even virtually, to celebrate the incredible nurses and clinicians of V&A Care who have been true heroes during this pandemic, on the front lines every day since day one, and to recognize the generous sponsors and donors who help make this work possible. As I think back over the past 8 months, I wouldn't have been able to imagine the pace and scale of change needed to respond to the challenges we face. Even for an organization who has been a trailblazer for 130 years, including through the Spanish flu, tuberculosis, and the AIDS pandemics, this has truly been unprecedented. In a whirlwind of activity, we established emergency resources for both patients and staff, shifted operational capacity, rapidly expanded the rollout of telemedicine equipment, made thousands of small pivots in our daily routines, and developed large-scale contingency plans. All of these efforts have been critical to our ability to continue to provide high-quality care throughout the pandemic. For us, this was an urgent call. The people we serve are the very ones most at risk and vulnerable to COVID-19. And those who provide this care, V&A Care's nurses and clinicians and support staff, are the ones who deserve our appreciation and gratitude. They are constantly overcoming daily challenges with passion and resilience to carry out our mission, ensuring our patients, even those with incredibly complex needs, can remain at home, outside a facility or hospital setting, where they most want to be and where they are the safest. Their dedication, courage, and compassion has been nothing short of inspiring and heroic. We We have had hospice clinicians stand in for loved ones while their fathers, mothers, and sons passed. The physical therapist conducted a home health care visit standing on a box at the edge of someone's window. A nurse worked with the homeless shelters to help prevent the spread of the virus, not to mention the creativity and dedication of case managers, schedulers, and office staff who equip our clinicians with the support and resources they need to deliver safe care to our patients. It is a testament to their work and our critical role in the healthcare system. So many donors stepped up, and we are truly grateful. I also would like to recognize our wonderful sponsors who make VNA Care's work possible. Thank you to our presenting sponsors, Corridor Group and Home Care Home Base. Thank you to our trustee sponsors, Amy and Joshua Boger and Mutual America. And thank you to the rest of our sponsors. Your partnership is greatly appreciated. Our fundraising efforts continue and are more important than ever. You'll see an opportunity to give throughout this great night. We have an outstanding program planned for you this evening. Thank you to everyone who helped plan this event. All of you have our gratitude. Thank you all.
Thank you, Todd. It's my pleasure to introduce you to Rod Hemingway, occupational therapist at VNA Care.
VNA Care is different from other home cares in that we have very long tenured, experienced clinicians who've worked particularly in the city of Boston, which is where we have a very long history of service to the community. We get to know our patients. What is it like to go into someone's home? I treat it as an honor. I treat it as it's their residence. I want to make sure that what I'm doing and how I arrive is a way that honors their personal situation, their culture, their home life. They may be overwhelmed. They may be tired. They may be ready for a stranger not to be there anymore. It's as basic as it is. It's sometimes going in and seeing the intimate parts of their lives. It's important. I want to honor them and know that their situation is important to me. It's confidential. So what is it like to work in home care during the time of COVID? It's different. The concerns I see from patients and family right now is one, they have a fear of the virus. They have a fear of the pandemic. They have a fear of getting sick. They also have a fear of us getting sick. It's emotionally draining. I worry about these patients we talked about before who we've had for years, who are chronically ill. I worry that they may not have a good reaction to this virus. Or I also worry if I haven't seen them for a while, I don't know how they're doing. That's hard in a field where we serve people. We have compassion, we connect with our patients. And it's really difficult and worrisome when I don't see someone that I know probably should be coming on our caseload because I know they're regular. What does my job mean to me? I have an opportunity potentially every single day to make a difference in someone's life that could give them comfort, give them ease. I believe in the mission of the agency, which is to serve our populations of all people, all comers, all demographics. The Gala is an important piece to help further our mission at the VNA Care in order to be able to continue to service our community, to help our patients, to help our staff, to keep us going, keep us safe, keep the lights on, keep the mission of this 130 plus year old organization moving forward. I can't imagine a better word or group of words to say than thank you. And with your donations, we will work hard every day to make sure that money is put to good use to keep our community healthy and to keep our community going and to emerge from this pandemic stronger, more united.
Rod, you're incredible. Thank you for sharing your story, and thank you for being a volunteer on the Gala committee. Now it's my pleasure to introduce you to Jessica Piper, nurse practitioner with VNA Hospice and Palliative Care.
I'm a palliative and hospice nurse practitioner. I go to people's homes and I assess two categories of symptom management and goals of care. And my symptom management is oriented to diagnoses that are chronic and uncurable. And my goals of care are what is important to the patient. My patient I've had for, I think, 3 years in East Boston, a proud 91-year-old who lives alone still in the house she grew up in. Yes, she's interstitial lung disease. Yep, she's got congestive heart failure. And yes, she falls about twice a year and breaks something important, but she bounces back every single time. And despite me and orthopedics and everybody involved in every single one of those falls telling her, we don't know, are you going to bounce back from this? She does. And she is so proud to tell us off and show us exactly how well she did. And I love seeing that. And I love being wrong. I would say the difference in visits that I miss the most during COVID is personal touch. Just a hug, just holding their hand when a patient is actively dying. And I can't do that in COVID. And I miss that so much. And all the air hugs in the world and it's not the same. You put your work hat on and you get in the car and you do all the personal protective equipment and do visits and gain people's trust and manage symptoms. But when you come home, you really are stripping down out of those clothes you wore all day. You're getting in a hot shower, you're Lysoling all of your things, you're cleaning all the equipment you used all day. So you have your mom hat and your work hat, and maybe once a week your workout hat. But it's being able to take off each of those hats and knowing your emotional boundaries. And I would say for 99.9% of even healthcare workers, that's not possible. We're a nonprofit organization that depends on donors to help us continue those services and to come to a venue, even though it's virtual, in order for us to say thank you for caring that a clinician will come to your house, a therapist will come to your house. That means everything to us. That gives us back that feeling that we're appreciated. We appreciate and thank you for giving back to us what we put into you.
Thank you, Jessica, and thank you for being a volunteer on the Gala committee. It's now my pleasure to introduce you to Shannon Martens, medical social worker at VNA Care.
When we're working together as a team, we really are a cohesive team with a lot of experience that we can pull together to help our patients and families. Now, in the times of COVID, we're doing a lot more of that hands-on because a lot of people are closed, and we're it. We are the social worker in the home. There's not other social workers coming in behind us, which would have been the case pre-COVID, especially after coming home from the hospital. A lot of people can't drive. And then sometimes it's helping them access, unfortunately, food stamps or food pantry, fuel assistance at this time of year. We have a lot of patients that have to pick between groceries and prescriptions. I had a patient recently that really is not able to pay his rent because he has to buy groceries and he has to pay for his medicine. And so how do we help that patient? So sometimes the best way we can help them is sitting right with them and making those phone calls and helping them navigate through all those prompts and sitting on hold and being there with them. We also have a lot of individuals that are really having the impacts of social isolation. So they're needing a lot more of that counseling that we can do to help them through being anxious and feeling depressed and feeling isolated. Caregivers that are in, a sandwich, generation type situation, they have their own children that they're now trying to figure out their schooling and remote learning, but now they have to care for their elderly parent or loved one. And we have grandparents that are caring for grandchildren so that their children can work. So it really is impacting the whole family system. You know, we look at the person in their environment, everything that impacts them, from what's happening in society, like the COVID pandemic, to their ability to access transportation, get to the doctors, afford groceries. So we take all that into account when we're looking at our patients and we're doing that visit. My dad had had a heart attack very unexpectedly. And when I brought him home from the hospital, he was refusing surgery and I did not know what I was going to do. And I'm in the field and I had no idea. And so I immediately knew without hesitation, VNA was going to be the agency that was coming in to help us kind of figure this out. And so we did. We had a nurse and a physical therapist and an occupational therapist, and they made a huge difference. My dad ended up getting some surgery because I think he was able to see just a little bit how some of those services could really improve his quality of life. That's why I love my job. It's the gifts I get at every visit. Even on the tough ones, there's always something.
Shannon, thank you for all you do. So important. I'd now like to introduce Felicia Avery, a registered nurse and clinical manager at VNA Care.
I think for patients, for our clinicians, especially those who've been here for a very long time, we're very proud of our staff and the work that they all do. I think what really stands VNA or sets VNA apart from other agencies is that we're able to take care of the total patient in terms of total care. So if they need a speech therapist, we can get that discipline involved. We have occupational therapy, we have physical therapy, we have nursing, we have LPNs, we have a palliative care team, we have a hospice care team. So we're really able to take care of patients, their families as a whole. We all have that same common goal. Our patient is the center of our focus. We have clinicians that, in order to take care of our patients, have lived separate from their own families. And that's just to ensure that their kids are safe, their caregivers are safe. We did things even ahead of the game, such as, when at the peak of the pandemic, before assisted living facilities and any congregate living spaces, before, we identified these as hotspots, quote unquote. And before the CDC had recommended, we just identified, all right, well, we have a lot of patients here and we have a lot of staff going in and out to these patients. How can we do this and do it safely? So what we decided as an agency was our clinicians will wear isolation and 95 masks in any congregate living, any ALF space. Well, this is when the nurse in me comes out, and you may not be able to see, but my eyes are tearing up. And I would just say thank you so much, because really we wouldn't be able to do what we do.
Thank you, Felicia, for sharing your experiences. Thank you so much for being with us tonight. To close things out, I'd like to welcome a very talented musician and songwriter, Morgan Minsk, to play for you.
There's a time to laugh and a time to cry, a time to quit and a time to try. There's a time to dance and a time to mourn. Time to be born, but what do we do when our time is almost through? We silent, and a time to speak. So don't be afraid to let go, my friend. Though your heart is torn, there is time to mend. But what we do when our time is almost through, just press rewind, search your mind for pictures of time. Ooh, though you travel to brand new places and shine like the brightest star, though we must part, the end is really just the start. There's a time to meet and a time to part. Though we say goodbye, this is just the start.
Hello, everyone. This is Chanel Sugar with Sugar and the Essential Spice. Right now, I'm in lovely Las Vegas on vacation, and I'm looking forward to seeing everyone next year. But I would like to say thank you so much to the nurses and thank you to the VNA, okay? And we're going to get through this, okay? Now, you take care, stay safe with you and your families, and we'll get down and rock steady, baby! Rock steady, baby! All right? We'll see you next year. Sugar and Essential Spice Band. Thank you.